Hi everyone, welcome to Mommy Trainee. Today I would like to talk to you about giving medicine to your young kid or your babies. Just last week, my 3-year-old son was a little under the weather, so there are a few medications that I have to give him, once or twice a day, and it kind of prompted me to thinking a little bit about what I've been doing, or for the last 3 years. How have I been able to give him medicine and making sure that he is taken care of. So when your baby and when your kid is sick, they're not really in a good mood, and that they could be crying, they could be cranky, and they look like they're beet red when they have fevers, and it's actually very hard for a mommy to watch. And obviously it's very distracting, and sometimes when they're crying, you'll be heartbroken when they're so cranky to a point that they were slapping you. Very heartbroken, obviously. But then one of the things that I've learned is that even through the times when he was really loud, he was really cranky, and I feel like I don't know what to do, I feel like if I could just put him down at a safe place and just kind of step aside and take a deep breath and just kind of just take a breath, and everything, I feel like everything is going to be okay. Because then at that point, when you have more oxygen in your brain starts to think and function a little bit better, and you'll be a little bit less stressed. And then you could think of what you need to do and make sure that you did the right thing. And in terms of medicine, obviously you wanted to make sure that you're giving them the right dosage. So the first thing is make sure that you have a clear head and you are not distracted. Hopefully you're not too tired at that point. So the first thing is that one of the habits that I've been forming in the last 3 years is that whenever I'm giving him any medicine, I would actually read the label at least 3 times. So obviously, first of all, let's just say, for example, if you wanted to give your kid Tylenol or Advil, ibuprofen, for fever purposes, the first thing when you take the medicine out of your drawer or your fridge is obviously identify, is this really the drug or the medicine that I need to give him? Really take a moment and read, okay, this is the ibuprofen, so I'm giving him ibuprofen because he has a fever. That actively goes through my mind when I was reading it. The second thing, obviously, is that I would need to read how much I have to give him the dosage. Usually, for kids or babies, it goes by the body weight. So in our medicine bottles, I have this all redacted, obviously. But when I have a big bottle of ibuprofen or Tylenol, when it was prescribed, they would actually say, how many milliliters. Let's just say the first time when I got this, it was based on his weight, that is, 15 pounds, let's just say, and it's supposed to be 3 milliliters, let's just say. And I'm not saying that it is, but just making up numbers here. But then maybe 6 months later, he is not at that weight anymore. So I would actually, when I get a chance, I would actually obviously have to get his correct weight. And another thing is that when a child is sick, they tend to lose some water. So the pound might be fluctuating, even like maybe within plus or minus 1 or 2 pounds. So you have to really try to get the weight as close as possible and then find out what the dosage should be. But once you find out what the dosage is, I actually just take a permanent marker and actually write down, cross out the old, let's just say 3 ml, and say if he is now should be at 4 ml, I would just say 4 ml based on whatever weight. You could probably date it, but then I think more importantly is the weight. So next time when you know that, oh yeah, he's now 27 pounds, so the one that's 24 pounds obviously not right. So you would always kind of have a gauge as to whether that dosage is correct. So reading the label, that's already reading, making sure that, okay, this is the ibuprofen that I wanted to give him. How many milliliters based on his weight, is it correct? And then obviously let's just say if it's 3 milliliters, you take a syringe. These bottles, when you open up, there's a little hole. You just basically take the syringe, pluck it into a little hole, put it upside down, and then just pull to, like, let's just say in this example, 3 milliliters. Once I do that, I would actually just visually, I'm a very visual person, so visually I would actually just put them side by side and say, okay, it is ibuprofen, I'm giving it him for fever. And it is, at this point, I'm giving him 3 milliliters. Is that correct? I would read it at least once or twice to make sure that, sometimes when you're distracted and when the baby is screaming and crying and kicking, or maybe you are just so tired because you haven't been sleeping all night, 0.3 could be very easily mistaken with 3 milliliters. And even like nurses in hospitals, they do medicine all the time, and it could get mistaken even for them. So as a mom, as a very tired mom, as a mom of a screaming baby or a kid, you owe yourself that favor to really read it again before you actually bring this to your kid and give it to them. That is very, very important. And one thing about these bottles, never really like refill these bottles with something else, because even like if another prescription or anything else, just don't, because you don't want people to be like other people, if it's not you, or like let's just say a grandparents, they come to your house and they're like, oh yeah, to give them that, and I think this is the bottle, and give them something that's not really what you wanted to give them. So that's very important. I would really like recycle these, take out the labels and peel it off, recycle these bottles. Do not ever use them again. So the next thing is that I wanted to talk to you about these syringes. One thing I know about these syringes is that, or administering medicine to young kids with these syringes, is that you only get one chance. You basically only get one chance to get it right, get it into their mouth, and give it to them, and that's it. So the first rule for me is that however many dosage, let's just say if I used to use a 5 milliliter, which is 1 teaspoon syringe, I would, use it only, use it to administer any medicine that is like 5 milliliters or under. If it's 6 milliliters, even if it's just a little bit more, sometimes there was this one time I actually got a dosage saying like 3.2 milliliters and they suggested that I use another syringe. I'm like, no, not gonna, like after this, they're not gonna be taking this, no. So whatever the dosage is, make sure one syringe would have your whole dose, because if you have to fuss with getting this out and putting it in a syringe, he's not gonna take it, or she is not gonna take it. One of the things is that, like, so in terms of sizes, there are a lot of different sizes. Like we basically just refill our medicine at Target, which is now CVS Target pharmacy, and they give you syringes, especially if they know that the medicine is for a kid or a baby. They always comes with these syringes for babies because it's always syrups. Again, use the one that would hold your whole dose in one syringe. And one of the things that I've learned is that obviously, when you have the syringe, you have to make sure, don't point it right at the kid or your baby. Baby might be okay because they don't move that much. Kids, they move everywhere. You have to be very careful with them with sharp objects. And the trick is to kind of lay the baby down or the kid down like at a recline position. Maybe have, if you have one of those little chairs that reclines for them, or if you have your spouse hold the kid at like an angle, it's actually easier for them to take it in. And when you are giving them the medicine, make sure you put the syringe into the side of their mouth, so that when you're shooting out the medicine, it's not going to go directly, like shoot right into their throat opening, and they would kind of like go down the wrong pipe or choke at it. And sometimes when they choke, when they cough, at that point, if medicine comes out, it's very hard to tell exactly how much of the medicine that you have lost. So, and you don't want to be like topping it off, quite honestly. For me, I wouldn't feel comfortable. Like if he lost the medicine, I have to wait until, I don't know, 6 to 8 hours later. That's the reason why I'm usually very careful in terms of when I'm actually giving him the medicine. I give him like very, very tiny in increments. So I would give him like maybe like a little squirt into his mouth, make sure he swallows, or at least it drips into his mouth, and then do a little bit more, and then do a little bit more, just very small increments, so that you, even if it, like if you have very small increments of medicine into their mouth, even if they cough it out, at least you won't lose the whole dose of medicine, which to me is very important, because I know that I'm not going to be that brave to, hey, let's just give him another meal. No, not me, because overdosing on medicine it could be very devastating to their health. Like for Tylenol, it could damage your liver. For ibuprofen, it's actually it could wreak havoc on their stomach lining. So you tend to try to not give them too much medicine, or if any at all. But when you have to do it, that's the way that I would do it. Give them in small increments to make sure that you don't lose any medicine. Another thing about use only one. Oh, another really, really good use when they're sick is, my son hates water, especially when he's sick and he's dehydrated. He hates water even more. Some people would say, give them juice, give them some like watered down Gatorade. When you're sick, you don't even want to drink that. And obviously when you're sick, especially when you have fever, you get dehydrated very, very quickly. And in a very small body like that, it could be very devastating. There was this one time that my kid has dehydration, not because of fever, obviously, but he has dehydration to a point that he has to go to hospital. It is not a pretty sight. You want to avoid that at all costs. Not a pretty sight. So one of the things that I learned from my pediatrician very early on is that if he doesn't want to drink anything, I would actually use these syringes to administer water, or even what do they drink? Pedialyte. They actually suggest Pedialyte, which is kind of like a baby version of Gatorade. But Pedialyte is supposed to be replenishing their electrolyte. So what I do is I would obviously use this every like 15-20 minutes, squirt some into his mouth. Even if I have to force him to drink it, I feel like that is much easier to do than to give him a cup, or give him a sippy cup and have him actually drink it. Because this I could kind of force him to do. Like it's just a little bit, like every 10-15 minutes, 1 teaspoon. But it kind of keep him, or at least try to keep him hydrated throughout the day. It is a lot of work, but then when they're sick, you gotta do whatever that you have to do. So that's one very, very good use. I keep a lot of these in my drawer, and different sizes in my drawer, and that's specifically for that use. One thing about administering medicine is that, let's just say if the dosage say 1 teaspoon, do not use an actual spoon. Spoons nowadays, they comes in all different sizes. They kind of look like it's 1 teaspoon, but they're not really exactly 1 teaspoon. One could be like, let's just say, more concave than the other. The dosage could be like pretty dramatically different, especially in a small body like that. So never actually use a spoon. Always use some kind of measuring devices like a syringe. And recently I have found that if there is a dosage about, like, let's just say 1 teaspoon or more, and if the medicine is not something that's really sticky, like if it's a really runny one, like I have to give my son some Zarbee's cough medicine. It's not exactly, it could be a cough medicine. It's for cough, but it's a little bit more natural than, let's just say, Robitussin. I've been using these kind of spoon, I would say, measuring spoon. So you basically just, vertically, just put it on your table, and then there's a little hole. You pour in your medicine. So it has either teaspoon, it's up to 2 teaspoons, or 10 milliliters. And if it's something that's really thick, I wouldn't put it in here, because you would have to tilt it, wait for the medicine to kind of drip down here, so that in these that spoon or spouts or something, and then it would be like ingested. So something really thick, it could take forever. And again, when they're sick, they don't have patience. If it's something that's really, really thick, I would rather use a syringe because I know that I could push out every little bits of the medicine, so it would be more exact. But for something like a Zarbee's, I would actually just give him, let him use this. It's not very, very thick, although it's kind of like a honey-based type of remedy or medicine. 1 teaspoon, just fill it up to here, and I give it to my son. We have a yellow, blue, and white. He get to pick a color. Let them pick a color, because that's basically the only control that they have is, okay, you have to have your medicine. So the way that I'm feeling that he could gain control over is what color spoon do you want to drink this medicine in? And he's usually pretty good with that. So I give it to him, and he knows that to put it into his mouth, tilt it and drink. And most of the medicine, if it's thin, it would drip all the way down, and that would be actually quite easy especially for kids that's a little bit older, like toddler. One of the things that I found in the last year or year and a half is that when you are getting medicine from, let's just say we got it from Target, CVS Pharmacy, they actually could give you, or you do have a choice, I should say, you have a choice of flavors for these medicine. Recently, I found out the hard way a year and a half ago. Well, actually, not recently. A year and a half ago, I found out the hard way that my son hated the Tylenol because of the cherry flavor. Every single time when he is having ibuprofen, which is orange color, he actually asks for medicine. I need medicine, mommy. Tylenol, when he sees a syringe with red in it, he runs for the hill. And I'm like, maybe it's just the taste. Tylenol and ibuprofen is very different. But no, when I refill the Tylenol and I ask them for a different flavor and they give me like an orange because I requested orange, when I give it to him, he is enjoying it. I'm like, what? So I've been suffering all these time for no reason just because it's cherry. I hate cherry myself, so he definitely takes after me. But one of the things to get your little ones to be open to having medicine is to request a flavor that they might like. Orange, apple, grape. Even he has a chewable vitamins that he takes every single day. In the past, it was a liquid form, brown. Like, that's not something that you could put flavors in, and you have to kind of hide it with like milk or juice. And once he gets to the chewable, he could choose like a flavor. Right now he's on grape. He actually and it's kind of like candy. I keep on telling him there's only one, we call it Vai in this house. Because when he was younger, he can't say vitamin. And so we call it Vai. So you could only have one Vai a day, and every single night when I shake that bottle of vitamin, he comes running and he give me a hand, like a scoop like this, so that I could put it on him so he could eat it. So that's the power of flavor. So if your local pharmacy could give you the option of choosing the flavor, definitely try different flavors to see what they like. Usually when we're at the pediatrician's office, when they write the script and send over directly electronically to the pharmacy, we would have asked them, oh, can you put down like orange flavor? Can you put down apple flavor? Just whatever you do, just make sure he doesn't have cherry. That's all I ask for. So that's it. That's all the things that I wanted to go over with you today. Hopefully, your little one will never get sick ever again. But if they do, hopefully this would help you. Well, until next time, thank you for watching. Bye-bye.